This is Late Night Health. This is the radio show that cares about the most important part of your life, your health. Hi, I'm Mark Alyn. During the next 2 hours, the insane Daryl Wayne and I are going to talk about a number of topics that touch each and every one of us. We're going to be talking about business and how doing business and sharing goodness will help not only your business, but yourself. We'll be talking with Travis Katz. I think Travis was on the show a couple of years ago. He's sitting in studio. Travis is somebody I've known for a few years, and a few months ago I went to the doctor. He had a lump on his thigh. Turned out to be a significant kind of cancer. He's going through treatment for that right now. We'll find out about that. Robert Clancy will be joining us, the author of The Hitchhiker's Guide to the Soul. With all the hatred that's been in the news, it's a good topic. We'll be talking about hatred. Mark Pylon from the Komen, Susan G. Komen, will be joining us and talking about the Citadel Outlet's 12th annual shopping extravaganza. And we're going to begin with a brand new friend of the show. Her name is Seppi, and I'm going to blow your last name.
Alyn.
Yes. Seppi has a master's degree in physical therapy, but for the last 17 years, she's been practicing something called Myofascial Release. Last week, I had the opportunity of meeting Seppi and walking through an oasis in Reseda, which is not known for having many oases, I might add, was an amazing experience. The flowers, I understand that there were chickens running around there too. I did not see them myself, but it was just a beautiful garden area before you reach the office. And when you get into the office, not only does it smell good, the treatment that I had relaxed me for 2 days, and I thank you for that. Seppi, welcome to Late Night Health.
Thank you very much, Mark and Daryl. It's very nice to be on your show and to share some information about the work that we do, which is myofascial release. Thank you for having me.
Our pleasure. You began your career as a traditional physical therapist. When did you see the light switch that said, this is what I need to be doing, not traditional physical therapy?
Correct. Yes, I have been in the field of physical therapy for the last 28 years. I've worked in many different settings, from outpatient to hospital settings, orthopedics, neurologic, geriatric, pediatrics, wound care, everything you can imagine I had done. And after I graduated with my master's degree, I had hoped that I would be able to truly help my patients deal with their conditions and overcome their pain and dysfunction. And unfortunately, I felt a little stuck in the traditional model. I wasn't able to do what I had hoped I would be able to do with the training and the knowledge I had gained from my training. It wasn't until about 17 years ago when I attended my first myofascial release seminar with John Barnes, and I do want to clarify that the work we specialize in is the John Barnes' myofascial release approach. And after about 5 minutes of listening to John bringing up the same challenges that I had been dealing with every day in my career and with my patients, I just knew at that time this was my calling and I had to pursue it. So I attended all of his seminars over the next year. I repeated all of his courses. I began to assist with some of his training seminars, and since then I have only been practicing the John Barnes' myofascial release approach at our practice, which is From the Heart Physical Therapy. I'm
really curious about this. Traditional physical therapy, and I've only had maybe 10 visits in my life. Physical therapy is why we started Late Night Health. I had a back issue, and the insurance company gave me 5 visits and said, no more, we're not going to allow this. And I went ballistic, and about that time, a very kindly older gentleman, Daryl Wayne, called me up and said, if you could go back on radio, what would you do? And out of my mouth spewed a 2-hour weekly show empowering people to take charge of their, to take care of their own health care, to empower them. And that's what we do here at Late Night Health, offering a variety of techniques, of solutions. Is myofascial release a solution? I'll start with pain.
Yes. Unfortunately, with the traditional model of pain management, the insurance companies and the medical model that we follow here in our country really ties the hands of the practitioner behind their backs and expects them to do magic. A lot of healthcare practitioners are not able to give their patients what it is they need in order to recover and improve. And that's why I got out of the traditional medical model, because it was always just dealing with what the insurance companies were requiring, and the focus was not being placed on the patient and their well-being. So to answer the question about, can myofascial release be the answer to pain? Absolutely. This is why we do this work here at From the Heart, and every day we see patients who come to us after having been to multiple healthcare practitioners. In many cases, they've had multiple injections, many different surgeries, and they are still suffering and having a lot of pain, a lot of dysfunction. Oftentimes, patients lose hope. They become depressed, and they just don't know what else to do. For many people, we are the first stop, but for also many people, we are their last hope. And myofascial release really can be a life-changing experience, and that's why we have our slogan as a life-enhancing journey. In many cases, that's what happens for people.
And you can sit. When I was there, you could not sit. It was over 100 degrees. But you welcome your patients to come and sit in your garden and meditate and just relax. It really is beautiful. Our guest, Seppi, she has a master's degree from Cal State Northridge in physical therapy. She practices myofascial release, and she is the head of From the Heart Physical Therapy, based in Reseda, California. Seppi, we have just a couple minutes left in this segment. What is myofascial release?
Right. So myofascial release is a very safe, gentle, hands-on, whole mind-body treatment approach that produces consistent results in reducing or eliminating acute or chronic pain and ultimately restoring health and function. And it's done through releasing restrictions within the body's myofascial system.
Myofascial. We have fascia. You said something to me. You said that when you were working on cadavers in school, that the instructors told you this fascial stuff that covers most of the body, I guess under the skin, just peel it away. It doesn't do anything. It doesn't mean anything. Am I correct in that?
Well, not so much that it doesn't mean anything, but they weren't really teaching us on the importance of the fascial system. For us, they wanted us to tease away all the fascial web in order to get to the important structures like the muscles and the tendons and the nerves and the blood vessels. So a lot of times they think of the fascial system as just packing material. However, in my experience and treating, so many patients over the years, we have come to find out that the source of many people's pain and dysfunction is tightness, restriction, and torsion within the fascial system, which affects the entire structure of the body. The fascia is an elastocollagenous tissue that runs uninterrupted from head to toe inside the body in a densely woven three-dimensional web-like system. And this system not only surrounds, but it supports and protects every part of your body, all of your organs, all of your muscles, your bones, your nerves, your blood vessels, all the way down to the single cell level. This system basically covers and interpenetrates everything in the body. And basically, the fascia is the immediate environment of every cell of your body, and it affects the health and function of every cell in your body. So
and because we only have a moment left now,
sure,
and we're going to continue in a second. So when I was on your table, you were stretching, pulling, and pushing in a very gentle but firm manner, and you were releasing the constricture of the fascia. Is that what?
Correct. Exactly. Yes, it's done through gentle, sustained elongation or compression, like you mentioned, into areas where we see the system is compromised or restricted.
All right, we're going to take a break. We'll be back with Seppi in just a couple of moments. By the way, you can always visit latenighthealth.com. Seppi's beautiful picture will be there. She is a beautiful woman. You'll see that, and her staff. And there'll be a link to her website as well. I'm Mark Gown along with the insane Daryl Wayne. Hey, do us a favor. Go to facebook.com/Late Night Health Radio, Late Night Health Radio, and like us. We'll be back. Don't go away. More coming up. Late Night Health is proud of our partnership with the EBC, the Evolutionary Business Council. Check them out at ebcouncil.com.
Welcome to Guide to the Soul. This is Robert Clancy. Opening your heart is the only way to allow all the light in. Unconditional love does exist, but it takes trust, something not a lot of people are willing to give. But how can you expect it if you don't provide it too? All hearts are refillable, rechargeable, and renewable. So why worry about being burned? By giving, you have everything to gain. Think of how beautiful your life would be if someone loved you without barriers, gave all of their heart to you without conditions, and wrapped their soul around you like it was your last day on earth. Today, you can be that person for someone else.
For more inspiration from Robert Clancy, visit GuideToTheSoul.com or go to the Moments with Robert page on LateNightHealth.com.
If you or someone you love suffers from drug addiction, now is the time to utilize your private health insurance PPO plan. If eligible, receive up to $30,000 or more in substance abuse benefits with low or no out-of-pocket cost. We are the National Treatment Network, the premier drug and alcohol treatment referral service operating 24/7. We help connect you with facilities nationwide that accepts PPO private health insurance for substance abuse. If you have PPO substance abuse coverage and you need immediate admittance to a medical detox or residential rehab treatment center, call us now. Call our live referral helpline today. The call is free. This program is not available to Medicare or Medicaid customers.
Call 800-296-1252. 800-296-1252. 800-296-1252. That's 800-296-1252.